Imagine it's the 1940s and your brother has trouble controlling his behavior. So your parents decide to take him to the doctor, and the doctor prescribes him a lobotomy. I know it sounds crazy, but it was a pretty common procedure back then, and it was used to treat things like depression, chronic headaches, and behavioral problems. So I recently took classes in anatomy and psychology, and we briefly touched the subject, but I went ahead and did a little bit more research. So today I'd like to talk about the brief history on the lobotomy. A few points I'll cover will be when and where it began, the procedures that were involved, and the aftermath. Now I think it's important because it's a part of medical and science history. So to begin, the lobotomy is a form of psychosurgery, and according to my psychology textbook by Sandra Zaccarelli, psychosurgery it involves cutting into the brain to remove or destroy brain tissue for the purpose of relieving symptoms of mental disorders. The lobotomy was developed in 1935 by a Portuguese neurologist named Dr. Antonio Egas Moniz, and he actually received a Nobel Prize to his medical contributions. Shortly after that, in the U.S., Drs. Walter Freeman and Dr. James Watts brought what they learned from Moniz to the U.S. And as far as the procedures are involved, there were 3 different types that were mainly used. The first was the prefrontal leucotomy and the prefrontal lobotomy, and the only difference was one was they drilled holes through the top of the head, and the other was through the top of the forehead. And they would sever the nerve in the frontal lobe to disconnect it from the rest of the brain. And the third procedure that was probably the most known was the transorbital lobotomy, and that was developed by Dr. Freeman and Dr. Watts. And this one was a little bit more gruesome. They actually used an ice pick, and they would put it through the upper eyelid and the top of the eyeball and use a hammer to go all the way through the skull, and then they would swipe it across the frontal lobe of the brain to damage the tissues. Now, I know it sounds gruesome, but that's actually what they did. And as far as the aftermath, well, some patients actually died from this procedure, and most people would become apathetic. They lost all emotional control. They couldn't plan things. They lost moral standards. They just couldn't work towards goals. So a lot of people suffered. Dr. Moniz, he retired, and ironically he was shot in the back by a former patient, and it caused him to be paralyzed. So that's the reason he had to retire. 1967, Dr. Freeman, he performed his last lobotomy after he accidentally nicked a blood vessel in one of his patients, and the patient bled to death. So this caused him to lose his medical license. So in the U.S. between 1939 and 51, 18,000 lobotomies were performed. And in the end, 50,000 people received lobotomies. The transorbital patients, they were often the most functional, mostly because the doctors would miss the nerve altogether. So nothing, thank goodness nothing happened to them. But the less fortunate victims were either institutionalized or they were returned to their families, which most of the families couldn't handle them either. So in conclusion, when and where lobotomies began, the procedures that were involved, and the aftermath. It tells us the history of the lobotomy. But by understanding the history, we can appreciate how far medical science has come. And to know our past, it helps us to know our future. If you'd like to know a little bit more, my sources, a really good website is psychosurgery.org, and there's a lot of good archives on there that go through different stories and actual stories from people that have dealt with loved ones that have had lobotomies. Also, Great and Desperate Cures, The Rise and Decline of Psychosurgery and Other Radical Treatments for Mental Illness by Professor Elliot S. Wallenstein. He is the author of this book. It's also a great source. And Psychology by Sandra Ceccarelli, second edition, was my psychology book, which is another great source. Thank you.